Matthew Holt, have you seen that JAMA report about medical debt? Worse than we thought.
Yes, not only have I seen it, I've had at least 3 PR people write to me about how their companies are going to solve the problem by lending patients more money. Not sure how that exactly solves it, but you know, maybe.
140 billion reasons to find out. It's the July 23rd episode of Health in 2.0. Really surprised about this medical debt thing? I mean, I'm not really surprised, are you?
Look, no one is surprised that there is medical debt in hospitals suing people and their terrible stuff. But what the study laid out, a bunch of people from Stanford and Harvard looking at the national medical expenditure, 17% of Americans, which is a lot, right? 1 in 6 has got medical debt in collections. Not that they owe money, but they're actually being collected on, which means that they've left the hospital and the crap being beaten out of them by a collection agency. And that debt has been sold on for pennies on the dollar by the hospitals, number one. Number 2, concentrated in what they call the lowest income decile zip codes. In other words, it's poor people who've got it. And number 3, concentrated more in the South where they didn't expand Medicaid. So basically, America's hospitals and doctors have been billing poor people for money they haven't got and then turning over collections. All works out fine.
If I were a billionaire, you know what I would do? Build a rocket and fly into space. I'm such a jerk. Okay.
All right. And what part of the anatomy would the rocket look like?
Exactly. Something that's well funded when it doesn't work and covered by all health insurance, you know?
Let's go. We have deals to discuss.
Our friend at b.well, Connected Health, Kristen Valdez, she raises $32 million, bringing the company's total up to $58.7. Matthew, what do they do? Remind us.
It is a personal health record, but she doesn't call it that. It integrates data from all different sources. They've done a lot of back-end stuff to get all that data in. They're kind of like a front-end management platform. Kristen used to be a senior executive at United Health Group and now is forging her own trail. Great person at Health 2.0 many times. Love them to death. It's a great tool. 7 million people covered lives now. Hopefully we'll do better.
What about Quick Genius? They get $64 million in a Series C. This brings their total up to $78.6 million.
Yeah, this is money from Kno2, who are the Swedish fund that have money in Livongo. They're splashing around now. British-based, does all addiction, right? Your cigs, your booze, your drugs, whatever it is, they got you covered. They've been growing fast. That's such a big market, addiction. You know, why not come here and sell some more of it?
Doktor.se, Swedish telehealth company, they get 29.5 million euros. Some interesting investors on this one. Tell me.
Well, they got 50 million last month, so it's just an add-on. But this new is like 30 million euros. This is from Tencent, the Chinese Secret Service, and now spying on telehealth visits, maybe.
Bayer G4A company, Sweetch. I interviewed the founder, Yossi Bahagadan, last year, I think it was. They get 20 million. What do they do?
This is one where they prompt you with sort of lifestyle choice stuff based on their emotional understanding of your emotional intelligence by dragging out your phone. Sounds very, very clever. Maybe it works.
All right, Kno2 gets 15 million in a Series A.
This is yet another interoperability play. Our Health Gorilla, Redox Scars, and all on that market. It's showing. And the interesting one is that Providence, right? The big chain that Aaron Martin runs. They've got money in this, so it's a. I don't know why it's different, but you know, we need more interoperability, as you know.
We always do. And 75 million goes to HealthifyMe, Healthify.me to be precise. Brings their total up to 100 mil.
You tell me I wouldn't get 6 in. I got 6 in.
That's because I just moved this right along.
So Healthify, as far as I can tell, Healthify is the kind of Noom plus exercise thing of India. They claim they have, 30% of Indians on the platform, whatever. And this is money from Leapfrog and Coaster and a bunch of others, Unilever and some others are in this. I assume they're coming to rich European and American countries. It says they're going to use it for North American expansion. I'm not entirely sure why it's different, better, faster, whatever, but it has 1,500 coaches on the platform already in India and around more than 20 million users. So, maybe it'll be a big deal. Maybe it'll disappear without trace. that market is pretty exciting. Don't forget that, you know, we were talking about our friends at Peloton and United Health Group yesterday. I'm still upset that United Health Group, A, hasn't recruited me as a member, but B, more importantly, if they're making, what do they make? 15 billion profit a year? Sure, they could buy everybody, you know, in the company. Sorry, all their members could be bought a Peloton.
I mean, I feel like with the medical debt story that we led with, and now the Peloton that we're ending with, there's like better things to spend that money on.
Are you suggesting that the people with the Pelotons and the people with the medical debt may not be interacting in those two Venn diagrams with maybe a tale of two Americas? Possibly.
Maybe not. I would love to know, and this is totally an aside here, but I would love to know how much of that medical debt that gets sent to collections is a result of people not being able to figure out how to read an EOB and understand what exactly is a bill and what is not a bill. Because there have been plenty of times, I'm health literate, where it's like, this is not a bill. And I'm like, are you sure it's not a bill? And I'm waiting for a bill, and that wait is a long way.
It's been total chaos for years. Who was it? ONC, MadPow, Alpha 2.0, and I forget who else ran a challenge trying to redesign the medical bill. And there were some great things. That was like 5 years ago. As far as I can see, none of that made it into anything to do. RWJ, I think, is involved. None of that made it to do anything with what you get. I still get the same thing. And I just went, as I said, as you now know, I'm a Blue Cross of Massachusetts member. And I went on to look at their online version of the EOB, which is guess what it is? It's the PDF of the thing. Mail. It's exactly the same bloody thing. I mean, it's like, it's still as incomprehensible as ever. And by the way, one of the EOB, they send you, because of the insurance thing I remember on my wife's employer, they send you $200 for joining a gym, or you can pay to join a gym or something. I don't know how it works. And that comes up as a negative claim. I don't even know, like $200 gets sent to you and you get a check, and then your EOB is like it's completely incomprehensible to any human. So yeah, I think you're right. A lot of this is people don't understand it.
I think in a long list of factors that you walk through at the beginning of this, I mean, I feel like the entire model is just pretty much effed.
I mean,
but yeah, the fact that you can't figure out what you have to pay for or what it's going to cost before you go in, it's like a big.
It doesn't help. But if you haven't got the money in the first place, if you're poor and sick in the first place, telling you that you should pay all this money. I mean, the stories that came out of all these hospitals have been suing people, including their own employees, you know, garnishing their wages when they're making $9 an hour and stuff. I mean, it's just beyond conscious. And by the way, all these same hospitals in general are sitting on massive reserves, you know, billions of dollars. It's hundreds.
Don't you have a spreadsheet about that?
I do. I need to update it because, you know, the reserves keep going out. I do recall that, I said in my healthcare tidbits the other day, that Ascension in the 9 months up to the end of March made $700 million on its healthcare services provision, $4 billion on the stock market. Which one are they? Are they a hedge fund or they do healthcare? Interesting. You can figure it out.
They must not have the same health tech portfolio that I've managed to.
Well, that was between the, you know, when there's low the stock market. And
you must have got out of Teledoc before it just cratered out. Okay,
all right, get us out of here.
Are we punchy today? punchy for the Friday episode. All right, so to follow along with us for the weekend, because God knows what we're going to talk about then, please go visit Twitter and follow him over at BoltyBoy. I am over at Jess and to keep up with what is happening over there on the healthcareblog.com, got some new interviews this week up there from WTF Health and some other episode of Health in 2.0 you'll want to check out. So sign up for the email newsletter. It will get delivered directly into your inbox Saturday morning-ish, depending, give or take a little bit. And check out our conference, which is, agenda unfolding magically over there at what'snexthealthcare.com.
Hopefully that should appear on the bottom of the screen if we get our act together.
Yeah, you know, got to ask for that.
And one thing you forget, Jess, is next week I'm on vacation, so you should probably bring in some interlopers.
Ooh, if you want to interlope, ping me at Justin Moss on Twitter or find my email.
Whatever happened to the other Matthew Holt?
Other Matthew Holt? I'm jilted by him.
Well, jilted. It's going to be double jilted next week because I won't be here either. Goodbye.
We're done. Bye.